It is an honor today. I was in New York City, and I was at the downtown at the Grand Hyatt, and my buddy is, you're like, what, 20 miles up the street? Where are you from?
Not even 20 minutes.
Not even 20 minutes? Mm-hmm. Arthur Volker. Art Volker. You go by Art or Arthur?
Actually, everyone calls me Artie, and that's usually my tagline, but
Artie? That's right. It
Call
says
me Artie.
Artie. Mm-hmm. But what's your avatar name? Art?
No, it's Toof DK.
Toof DK. And so you go by Artie, mm-hmm. and I'm just a huge fan of your post. I mean, when you a lot of people, I would say that the reality is probably 60,000 unique dentists go there a quarter, and everyone just lurks, and they're afraid to post a case because you got to have some guts, some big kahunas to post a case to have 196,000 dentists look at your case and say, hey, you did it wrong, or I do it this. And for abuse, if there's cyberbullying, we have a report abuse button, and when you click that, lots of us look at it immediately because we don't want it to be dysfunctional. But the bottom line is it takes a lot of guts to post a case. I'm a big fan of your cases. I mean, you post implant cases, amazing cosmetic cases. You put numbers on the teeth showing the symmetry. Seriously, dude, you're an amazing cosmetic dentist. But you were telling me earlier that you lurked for a while and then you started posting.
Oh, absolutely. So it's very funny that we were talking about lurking because I joined Dentaltown in 2004 at the suggestion of one of my resident advisors. And he said, there's a really cool website you should go to. He goes, everyone else is going to teach you the same baloney, if you will. He said, you have to go there because, people can speak their mind there. So I graduated from school in 2003, and I said, I'm going to join this because I want to see something different. And, there's a line that somebody wrote that says, you never practice alone again, and that's great, but you also really never practice the same way again. So for years, I would say from about 2004 to about 2013-ish, I lurked, and I loved it. It was fantastic because I was exposed to so many people. I can name drop here if you want,
Please,
but there are tons of people. I mean, obviously, everyone knows that I'm a big Jason Smithson fan. I was actually trained on the microscope by Dino. Even Phil and his funny socks were a big hit for me. There were just tons of people who I learned from, who I'm sure more names will come to me as we go along. But you just sit there and you just would watch. And I would sometimes watch a post or a thread for hours. And it was like, these are the most amazing dentists that I've ever seen. Now, mind you, Howard, I'm only out of school for a year or two at this time. And I'm watching going, you can never do things like that. It's totally beyond my reach. And of course, when someone like Jason posts or Dino posts or Melker's posts, you look and you're just like, that's inhuman. I mean, no human being can do that. But you go on over time and you learn more. And it just really, not only do you not practice alone, you never practice alone, but you never practice the same way again. And that's an absolute certainty. So I decided to post some cases just to test the waters. I was at the behest of a few people after a couple of my own residents, because I taught at a residency program at a hospital for a few years. They said, why don't you start posting your cases on Dentaltown and see what they say? And I said, are you crazy? That's the worst idea I've ever heard. But they did it, and I got some nice feedback, and some people asked me to do articles with them. And so I put some articles out, but let me tell you, being a lurker is not a terrible thing. It really isn't. But I'm so glad I posted because it really fine-tunes what you can do.
I always tell my four boys, they're Eric, Greg, Ryan, and Zach. Eric's 26, Greg's 24, Ryan's 22, Zach's 20. I tell them, when you come to a fork in the road, whichever one seems scary and uphill and hard, always take that. And the one that's easy and level or downhill, never take that. Always always pushing yourself.
See, when I see a fork in the road, I take it. And then I go eat. So that's a little bit my problem, but no.
You don't look like you have the problem as much as I do. And we should go to dinner tonight. You want to go to dinner tonight?
I'm absolutely in.
All right, right on. So I would say, you do a lot of things amazingly well. What do you do well the most? What are you focusing on? I mean, what's going to be your defining moment? Are you mostly a cosmetic dentist or a restorative dentist?
I don't love the term. I think all dentists really strive to do cosmetic work. I mean, have you ever seen anybody brand themselves as I'm the uncosmetic dentist? Right? But I enjoy doing anterior stuff. Again, I was very influenced by a lot of people. My mentor was a fairly famous cosmetic dentist. He would lecture with Erwin Smigel in the early 80s, and I sort of followed under his wing. And he taught me maybe it's because I'm lazy. Maybe it's because I enjoy the immediate gratification of, having some case, a patient walks in and then they walk out with a fantastic smile or an improved smile. Again, I don't love the term cosmetic because I don't think, if you look at some of the surgeries, I think they're absolutely cosmetic as well. But we strive to make everything as sort of beautiful as possible within the realm of the possibilities.
They're all different. Like some dentists, like I like emergency room. I like toothache dentistry. I like to get them out of pain, do a root canal, build up and crown, or pull the tooth. Some people like cosmetic dentistry. Some people think a screaming 3-year-old child is very stressful. Of all the 9 specialties, the one I would not do is a pediatric dentist.
Join the club, absolutely.
Yeah, I would just give them my license and go home. But close to that, a lot of us, a woman coming in who's 40 and she wants to look like she's 21 and she's got all these pictures and things written down and she wants a cosmetic dentist redo her tooth. Wow, I'd run. But would you do that case?
I don't see why not. As long there's the biggest thing without fail about attempting a cosmetic case. All right, and I don't think there's a person on DT who would disagree, is to manage expectations. I've posted several cases where patients have, and I know we spoke about some of the orthodontic combination cases, that I like to do, but I've also posted cases of these, what we like to call insane diastema closures that I did using Dave Clark's Bioclear matrix, of which I'm on faculty, so I do have a bit of a prejudice towards it. But, when I'm going to start a case, I'm going to say, listen, if you're not going to do X, Y, and Z, then you better be prepared to have it look like, A, B, and C. You have to manage the patient's expectations. How many times have I had patients ask for Julia Roberts' teeth? Or what was that, Haley Duff? Remember when she had those big, very bulky veneers? I had patients who brought in a picture of those. And I thought, are you kidding me? But you have to manage their expectations. And then if the patient wants those big, bulky veneers, as long as you're within proper function, health, marginal integrity, who are you to define what's pretty? Let me give you an example. I'm married. What was wrong with my wife's choice? She had no sense of faith. So people will think different things are beautiful.
Yeah.
So that's how I approach that.
But now that you mentioned in that company that you said to the board, there's listeners out there who don't know what you're talking about. So talk about that.
About the
Bioclear?
Oh, it's right. So it's a matrix system developed by Dr. David Clark, and
where's he out of?
He's out of Tacoma, Washington. And he has right in Tacoma, a real nice, very kind of working class area. But he's a bit of a mad genius. I don't know if any of you know him. He has the rock star hair, makes me jealous, and he has done a lot of stuff with microscopes. So as he started working on the microscope.
Now, what's his name?
David Clark.
David Clark.
Right. And he's, again, out of Tacoma, Washington, and he's the developer of the Bioclear matrix system. And basically it's a way to do things like diastema closures, black triangle reductions, predictably, and it's a whole system. The thing I like is that he's a guy who's an independent thinker, but a lot of his philosophies came about from working under the microscope. So when he was under the microscope, he says it's a whole different world. Now I have been using the microscope for a while, about 1.5 years now, and it is like almost looking into a science book. It's almost like looking into, when people used to look into the telescopes and you see a whole different world. It's a completely different world there. And you'll see, I think some of the top docs on Dentaltown are using microscopes, and it really is an unfair advantage. But so anyway, he was using this microscope, and he saw these different ways. And one of the things he saw was that traditional mylar matrices, flat mylar bands, a lot of times would leave ledges if you're going to do diastema closures. Now there's some very, very talented people on DT who can do it that way. And and we've seen cases, I just sit there with my mouth open, like, it's the most amazing thing. But as you look in the microscope, sometimes you'll see there's ledges, plaque accumulation. So what he does, he developed a rounded matrix system using a 50 micron thick matrix, and you place it between 2 teeth. You follow a very, very specific protocol, including rubber dam, removal of biofilm, and you can do composite fairly predictably. The reason I'm mentioning is that because I had such a case, and I posted on Dentaltown about an interdisciplinary diastema closure, and the patient had ortho, and sometimes if you overclose in orthodontics, you'll get this kind of weird square chiclet look. So I went. I had seen Dr. Clark. I think it was in 2006 at a lecture, and I bought the matrix system. I tried it out, and I sent it over to him. And I said, "Hey, thank you for your system. It was really terrific." And of course, he calls me back and he says, "We have to do an article about this." To which I replied, "No, I don't want to write anything." So he twisted my arm a little bit, and we ended up doing an article together. And he can't get rid of me now.
So what's his website? www.
Bioclearmatrix.com.
Bioclearmatrix.com. Has he done an online CE course on that?
He has many on his, and he has a lot of YouTube videos as well. I'm not sure 100% if he has anything on Dentaltown.
Tell him to put a course on that on Dentaltown, and we just talked about it, so a lot of people will want to see it.
Well, I outweigh him by 3 times or so I'll twist his arm.
And tell him to call me to do a podcast. Tell
Absolutely.
him to Skype me. I'd like to talk about it more. So what is so you've been out doing this a long time.
Oh, thanks.
Give people some pearls about approaching cosmetic dentistry.
Okay.
What would you recommend to people trying to be a better cosmetic dentist like you? What would you recommend that they do? What are some low-hanging fruit pearls for them?
I'll give them some low-hanging fruits, but first thing is I would say shoot for the stars. And by that I mean attend a course by someone like a David Clark. Go to some of the Cosmedent courses. I have no affiliation with them, but
Cosmedent and Buddy Moppert
in
Chicago.
Yes, and you have Newton Fall, who I think is absolutely fantastic. Jason Smith, he's out of Brazil. Jason Smithson, he lectures for them as well.
Out of England.
Oh,
Newton Fall lectures for Cosmedent with Buddy Moppert in Chicago.
Yes, they're at the Learning Center there, and
Jason
and a couple others, and those names will pop in my head in just a second.
Wow!
And if you're going to learn, you learn there, and it's
Buddy Moppert's amazing. He actually started as a pediatric dentist.
He did, and you know what's interesting? He actually uses more profanity than you, Howard, which
me?
I didn't think was humanly possible.
There's someone out cussing me. Oh my gosh! He's a great guy. I love that guy.
Him and his son is really nice.
And his businessman is I'm 100% Irish at 2 parents, 4 grandparents, and 8 grand. But anyway, O'Malley. What is it? Paul O'Malley or what's his business partner's name? O'Malley.
I don't know.
Good old Irish man. We always go out and drink green beer afterwards. But so go through. Educate us on how to be a better cosmetic dentist.
Well, first, education obviously is the key. I guess another pearl that was one of the best tips I had gotten from my mentor was always start at the 2 front teeth. I always find that it's very funny, but one of the things that I find, and that's why one of the reasons why I'm always putting numbers on teeth, is that I always find you get these beautiful layering, and I don't know if you see these guys in there, and let me tell you, there's some terrific young guys. Let me name check 2 right now, Matt Costa and Stephen Kuzmak, who do some just gorgeous color work with their composites. They're fantastic. But I see some people who will post some cases and they'll layer colors and they'll cut back and they'll do all this very fancy ceramist type stuff. And then you'll see that the 2 front teeth don't really look identical. So one of the best things I've always taught, and in my classes I always teach that, you want the 2 front teeth to be as symmetrical as possible, right? I mean, it's so simple, but all it would take sometimes is just to level, sitting the patient up, and that's the best tip. In fact, that is by far the best tip I have today, is never do your cosmetic work. Now, I'm a big guy, I like to eat, so I'm a righty, I like to work at the 9 o'clock position. The further away I have room for my gut, the better. But really, you can sit at the 12 o'clock. But when you sit the patient up, and I've seen this happen numerous times to my residents, they'll sit up, right? We'll finish a case. They'll have the patient reclined in the chair. They'll sit up, and all of a sudden the teeth are either going this way, one is kind of cockeyed, or you have a very bizarre cant. So what does the patient do? The first thing they're doing, they're sitting up, they're going to look in a mirror, right? Take that view with them. If I'm going to do a case, if I have to level an incisal edge, sit the patient up straight in the chair. Look at them just as I'm looking at you, and take a disc and level the incisal edges. I find that just really gives a great sort of look to the teeth.
And another thing I would stress is humility. So many dental assistants, the dentists don't utilize, but I'm sitting on this side. My Jan of 28 years is sitting on the other side. And whenever I'm looking at that, I always ask Jan. She's looking at it from the other side. And I can't tell you how many times she gives me great feedback. You know what I mean? I'm leveling or doing anything. I'm like, what do you think, Jan? I'd ask Jan 10 times before I'd ask more than the patient. You know what I mean?
Right.
Because she's on a completely different angle. So why are people, like when I take an impression, I always show it to Jan. And if Jan doesn't like it, she doesn't even tell me, oh, I don't like it. I think this area, I think we should. She just throws it away.
Right in front of you.
Yeah, I remember. She's like, and when the minute I see it hit the trash, I'm like, well, I guess we're gonna take another impression. You know what I mean?
So this one isn't good, huh?
Yeah.
Okay.
So humility. So what other pearls and low hanging fruit would you give these people?
Well, again, that's for me is the best one, and then it's really practice. One of the other best pearls is you still have some typodonts, hopefully left over from school. Practice on teeth. Practice your polish. One of the things I see is that a lot of cases I don't feel have the time to take the polish, not the final gloss, but the actual primary anatomy of the teeth, and have that smooth. You'll see pits, and a lot of times that can come from also an improper layering technique. But without question, the best thing I can do, and remember, the term is cosmetic dentistry. You were talking about being humble. I can't tell you how many times I'll have someone in one of the classes go, I'm a cosmetic dentist. There's no such cosmetic dental specialty. That means absolutely nothing. That's great. I'm an uncosmetic dentist. Like, what does that mean? So the thing is, humility, definitely, accept other people's criticism, and make sure those two front teeth are symmetrical. I think that's going to be an absolutely...
Now, when you talk about polishing, you talk about for direct composite veneers?
So direct composite veneers, which I think is probably one of the hardest, if not the hardest procedure we have to do to get correctly. And that's why that's one, the Jason Smithson disciple thread is so popular. That's why anytime the cosmetic dentistry section is so popular, because it's one of the harder procedures.
Explain to these listeners who have never seen you listen to podcasts, but they haven't seen the Jason Smithson disciple thread. That is one of the most popular threads of all time. Will you explain that thread to the listeners out there?
So and funny because we're talking about Cosmedent. So one of the townies, Matt Costa, he had attended one of Jason's courses in Chicago. And he just created a disciple thread, which is kind of dangerous because now we're breeding a religion of dentists. But hey, what are you going to do? And so what he did is he posted a case. And so people now started to post their cases as well. And you would get feedback. And I mean,
what kind of cases are they?
So they're all cosmetic cases, all direct composite cases. I think there were some indirect cases, but now it's grown to be an exclusively cosmetic, exclusively composite cases. So anterior and posterior. And the nice thing is there's a lot of international involvement. There's guys like Serhat Kokin out of Turkey who's posting some beautiful cases, and we have a couple of the Russians who post some absolutely gorgeous work.
That kid from the Ukraine, remember
from
that
Ukraine,
post?
Sure. Absolutely fantastic. Aquilo, I think he went by. It was absolutely fantastic stuff. And I love that now we're starting to see a lot of involvement there because, they have a certain aesthetic sensibility, and we as Americans have a certain aesthetic sensibility. I mean, even in the United States, right? We have an aesthetic sensibility on the East Coast. I'm from New York. I practice about 20 minutes from here. And then you get guys on the West Coast with their big chiclets, I'm just saying. But so yeah, I really like that there's so many.
Do you have any children?
I have two.
How old
boy
are
and a
they?
girl. I have a 10-year-old boy and a 8-year-old girl, and she's going on 18 very quickly.
So she's 8. If she came into you 18 and said, "Dad, I want movie star teeth," would you do direct or indirect?
You mean after I've spanked her for that? I said, I'm not too old to put you over my knee. Let's say 18, interesting, because that's sort of my mental cutoff on when I would do a direct composite veneer.
Really?
Right.
What do you mean by that? Explain.
So usually, and I have kids. Now how about this? What about trauma cases? Now I've posted a trauma case on DT using direct composite. What do you do if a 7-year-old boy walks into your office with a fracture, playing on the schoolyard, doing typical dumb boy stuff, falls down, crack, hits the front tooth, chips the edge? I had actually known somebody who said, I'm going to put a veneer or a crown on that tooth. I'm going to do the endo, and I'm going to go ahead and crown it. And after I was like, really? That's terrific, So I tried to take a more conservative approach than that. So I would opt for, basically direct composite up until about the age of 18. Now, there's certain materials I think work better than others. I will tell you that in composite in terms of maintaining their shine, and certain polishing techniques I think that work better than others. But again, a lot of it is how you handle the material.
Okay, well, name those products and name those polishing techniques.
Sure, absolutely. So, without question, I think right now given the current technology, I still think you cannot beat the polish of a microfilled composite as a final layer. Obviously, we know it's very weak, has a very low compressive and flexural strength compared to, say, a nano composite, and certainly against a a hybrid. The problem with that is obviously the large fillers make everything very dull, but then the small filler size, right, of a microfilled composite really maintains the polish. And I have cases going back, you said I've been doing this for a long time, so thanks for the bump, but I've been doing it for about 10 years. I've been out for about 11. I've seen cases that I did with microfilled on non-load-bearing areas.
Use name brands, though.
Oh, sure, absolutely.
Because my deal is with Dentaltown, no one has to practice solo again, so they want to hear. Somebody's out there listening saying, I want to know what you use.
Sure, absolutely. So for a microfilled, I think there's two major brands. I mean, I am very much use the Cosmetic brand as well, and they put out many different shades and translucencies.
Now, Cosmetic's Buddy Mopper.
That's Buddy Mopper's group.
Microfill Renamel?
That's microfill Renamel. So you have to say Renamel microfill, because I believe now Renamel is actually the composite name. So they have, Renamel Nano, and then you have Renamel microfilled. So this, you have to be very sure.
Is Renamel Nano, is that a hybrid?
That's a nano hybrid.
Okay, explain a nano hybrid versus just back in the day when it was just a hybrid.
A size. That's all it is. It's literally the size of the filler. So a nano hybrid just has very small particles of filler, and a microfilled is actually has.
So is it safe to say everything is a trade-off? If you want your car to be most fuel efficient, then make it out of paper mache. It's lightweight, 100 miles a gallon. If safety is your only thing, you're gonna make it out of iron. And you won't die, but only get a mile a gallon. Everything's a trade-off. So is it safe to say that if you have a hybrid, which means there's a lot of big particles of rock in there, it's going to be stronger for like the back teeth. But then when you go to polish it, when one of those big rocks comes off, it's a rough surface, whereas a microfill is just going to be really smooth and polishable, but it just won't have the strength.
Right, absolutely.
So the trade-off is if you want strength, you're going to go in the back teeth, and if you're going to want luster, you go to the front teeth.
Right, with them, right. So yeah, I would use something like a nano hybrid. But then is there a happy medium? Is there something we can use? I know 3M has a very nice product that we use a lot of times with the Bioclear technique.
Which one's that?
And that's funny. Filtech Supreme. Filtech Supreme Ultra, I believe, is what it's called. And I believe it's one of the few completely nano-filled, although I could be wrong about that, composite that handles nicely, it polishes, and most importantly, it maintains its luster for a good time. The problem, of course, as we talked about with the hybrid composites, is that, they would stay. They would stay in there very strongly. They just would look very, very dull when, fillers would get plucked out of the matrix, and you would have this sort of rough, irregular surface.
Okay, and you also talked about not just the composite, but you talked about the polishing technique. So what is your polishing technique?
Sure. So there's a technique, and again, remember, I do have I am on faculty at the Bioclear Learning Center. So it's actually called, and you can look it up on YouTube, has a very funny name. It's called the Rockstar Polishing Technique. Essentially, it's the use of a brownie point that you would use to polish an amalgam, a coarse pumice, and then you would use a particular polisher, jazz polisher from a polisher from Jazz.
Now, do you know how to load a YouTube video into a message board?
Yes, of course. I do it all the time to make fun of people.
Yeah, start a thread on that.
I put it in already in one. Somebody had asked me on one of my threads, how did you maintain your composite so shiny? And I said, I put in the Rockstar 3-step polishing technique.
Right on. So you want to stay and do dinner or something tonight?
Let's go. I'm here. I'm 20 minutes away. My wife gave me permission. She took the shackle off.
So you got a hall pass for the night?
I have a hall pass.
Right on. Well, hey, you're lecturing now.
I am.
And
yes.
You got 3 lectures.
I'll be in. Right, all of them are in the New York area. I'll be in Nassau County on Monday. I'll be in NYU actually this Friday. And then I'll be at a local study club next Wednesday.
Well, hey, if your study club or your dental meeting is looking for a speaker, I can tell you this guy is a rock star on the message boards. I love him to death. I'm your biggest fan. You have him speak at your next dental society, your next meeting. I'm your biggest fan.
All right, thank you so much. I really appreciate all that you've done for dentistry and Dentaltown, and also for dentistry as a whole. It's absolutely fantastic to have Dentaltown in my life since its inception. So thank you so much for that. That's what I want to say on the record. So I appreciate that. Keep that, print that, because I don't think enough people give you credit for what you do, to your face. And this is great that I get to actually say it into your face. So thank you.